Again, thank you. My name is Carla, and I'm the Director of User Engagement at NeedyMeds. And today, we're happy to present to you a special topic webinar, Free App to Securely Manage Health Records, presented by NeedyMeds partner, MyLinks. And before we get into the presentation, I'd like to offer a few tips so everybody could make the most out of today's webinar. First of all, if you do have questions, you can ask them at any time by typing them into that questions section of your GoToWebinar control panel. Just know that we do reserve answering questions until the end. If we don't have the time to answer your question, we will follow up by email, but you can always reach out to our organizations. And of course, I will provide the contact information for both NeedyMeds and MyLinks at the end. The heads up also that today's webinar is being recorded and will be available on the NeedyMeds YouTube channel. And you can find some attachments, including our PowerPoint slide decks and some other materials we thought you'd be interested in that handout section of your control panel. So let's get started with what is NeedyMeds. For those of you not familiar with our organization, we're a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Rich Sagel, and his friend, Libby Overly. She was a medical social worker. What you're looking at on our screen is our mission statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And as I said, I will have the NeedyMeds contact information up at the end of the presentation as well. This is a screenshot of the NeedyMeds homepage, and I always like to put that up because our website is really the face of our organization. And it also gives me the chance to point out just a few things. First of all, if you are looking for healthcare cost savings resources, you'll want to go ahead and begin your search under the, you guessed it, Healthcare Savings tab. If you're interested in educational information, such as ordering brochures, some of our drug discount cards, signing up for webinars, getting on lists to receive our monthly newsletters or program alerts, you would do that all under the Education tab, right next to that Healthcare Savings tab. I already mentioned that this webinar is being recorded and will be available on our YouTube channel, and you can find a link to that on the top right hand of our homepage with the rest of the social media icons. I suggest subscribing because that way you'll be notified when new content is being added, like webinars, presentations, and videos, so you won't miss out on anything. I also mentioned that you can find upcoming webinars under that Education tab, but you can also find them and register for them on the calendar of events on the bottom right hand of our homepage. So as you saw a couple of slides ago, a big part of our mission is educating people. And we do that by educating people about NeedyMeds and the resources we offer, but also by educating our users about other helpful resources for their health journey, which is why we are so pleased to have a guest with us here today from our partner, MyLinks. MyLinks is the newest innovation of the Patient Link company, which is dedicated to building innovative software solutions to provide data flow between patients and their care team, improving the lives of patients and clinicians alike. MyLinks is a free consumer-facing application to allow patients to easily gather, manage, and share their medical information at any time from one accessible and secure location. MyLinks is a cloud-based and mobile responsive app that allows patients to use any internet-enabled device. It also provides an easy way for caregivers to manage and coordinate their loved one's care among many healthcare providers. So as you can see, this is a valuable tool, and we are so pleased to be able to share it with NeedyMeds users. And I'm also happy to introduce you to my friend and colleague, Brian Beam, the MyLinks project coordinator. He's going to walk us through MyLinks, how to use it, and how it can help you. So let me tell you just a little bit about Brian. His background is in IT, e-commerce, leadership, and most recently, FHIR for the transmission of health data. Brian works as a project manager for PatientLink, where he uses all of his previous experience to work with his team to develop cutting edge functionality for patients. Brian held a large role in coordinating and onboarding thousands of health organizations on the MyLinks platform. So, without further ado, I'm going to go ahead and pass the mic and the screen to Brian. And as Brian goes ahead and grabs the screen, I will remind everybody that if you do have questions, you can go ahead and submit them by typing them into that question section of your GoToWebinar control panel. We usually do tend to keep the question segment brief, so don't worry if we don't get the chance to answer your question. We will follow up with you by email, and of course, you'll see the contact information for MyLinks and NeedyMeds at the end of the presentation. So with that, I'm going to go ahead and hand the mic to Brian. Enjoy today's presentation, everyone, and thanks for joining us.
Thanks, Carla, for the introduction. Excited to be here to show you a little bit about MyLinks. MyLinks is a free application to help patients gather, manage, and share their health records from one secure location. You can simply go to mylinks.com to check it out while we're chatting. So there's a lot of common uses for MyLinks. One of them is in case of emergency. Ideally, you'd want to have your records in MyLinks and share that with a family member before the emergency, but MyLinks is there to help in that way. It gives you a place to list allergies, medications, and things of that sort. So that way your caretaker, family member, or friend can kind of step in if you're incapacitated in any way. It also gives you a chance to identify errors. So medical errors are responsible for 250,000 deaths each year. 84% of EHR notes have at least one error, with an average of 7.8 errors per patient. As you can imagine, you probably don't want your doctors making decisions about your health with invalid data. MyLinks also gives you a chance to confirm and remember the next steps in your treatment plan. It's a good single place to store your family's records. You can access MyLinks records from anywhere, as long as you have an internet connection. You can share your records with whomever you wish. Statistics show that 20% of your doctors will not have a copy of your records from another provider when you arrive for an appointment. You don't need to reschedule. You can simply take your records with you in your MyLinks account and share with your doctor as needed. If your clinic moves to a new electronic health record system, you could lose access to your old records for that provider. MyLinks gives you the ability to download those records, store them in MyLinks, and then share them with new doctors as needed. You can also store important documents in MyLinks. MyLinks gives you a storage space to save important documents like driver's license, insurance cards, or any other medical file you may want to store securely. So know your rights. What I have here on the screen are basically the laws and mandates that have enabled the transmission of medical records to patients digitally. So as you may be aware, HIPAA kind of led the way for us long ago, giving us access to our paper records. But now we're kind of moving into the digital frontier with all of these laws. And so HIPAA's been updated to help with this. There's also been new laws like the Patient Access Final Rule. The Final Rule enables patients access to their healthcare record via any app of their choice, implemented via API-based interoperability between their provider's electronic record and their smartphone or other modern software apps. The rule supports secure patient access to their electronic medical record data. patients will be able to use applications they authorize to receive their data from their medical records using the same highly secure protocols already used in other industries, such as travel and banking apps. And then there's also the information blocking rule. So patients should be able to, this rule says that patients should be able to access their electronic medical record at no additional cost. Providers should be able to choose the IT tools that allow them to provide the best care for patients without excessive costs or technical barriers. And in addition to that, we also have the 21st Century Cures Act. This was designed to help accelerate medical product development and bring new innovations and advances to patients who need them faster and more efficiently. But it also has some language in there that is relevant to the transmission of medical records to patients. And then there's lastly the US CDI, United States Core Data for Interoperability. This is a standard set of data points that the government deemed should be available to patients. So I'll show that now. And this kind of gives an overview of the records you might get in MyLinks. So when you try to import your records from your doctor in MyLinks, we're going to try to get all of this data. Now, we can't always get all of this data because the provider we're pulling the data from may be on an older version of FHIR, or maybe they're not listed at all because they don't support FHIR yet. But that's changing quickly, and we have over 35,000 listings that you can potentially connect with to get your data from in MyLinks. So here's where your data is. MyLinks can help you pull this data from your providers, insurers, and wearable devices and aggregate that data into your MyLinks account. When you go to a doctor, he or she will most likely run tests, take notes, and enter them into their EHR, or electronic health record system. 85% of clinics report using a certified electronic health record provider, so it's likely that your data is stored in one. Traditionally, patients would see their data in their clinic's patient portal. Due to new mandates and laws involving patient access to their health data, EHRs and providers have been tasked with making patient data available to the patient using an app of their choosing. Not only do they have to make the data available, but it has to be provided with guidelines for which data elements should be available. The list of available data elements is generally more than what you can find in your patient portal. So this is kind of a quick view at some of the electronic health record companies we've connected with. We're constantly adding more each day. We're trying to, we would like to have as many connections as possible so you can truly get all of your data from all of your providers. So this is how you can get your data. You'd start by going to mylinks.com and creating a MyLinks account. You'd search for your provider within MyLinks. Once you found your provider, you could click on their listing and that would launch a patient portal. And then you would authenticate in that patient portal with your credentials that you previously had. And then you would review your data in MyLinks. And it would be saved there for safekeeping. And you could come back at any time to review your records again. So this is kind of a look at the gather page in MyLinks where you can easily search for your clinic or healthcare provider. Once you find your connection, you'd click Get Health Record and authenticate against the patient portal window that pops up. Then your data would be imported to MyLinks. This is what it looks like after you've imported your data. As you can see, we tried to pull data for all those categories you've seen on that US CDI list, and then we pull in what we can and display it. You can click on a category to see more details about the records in that category. For example, if you click in conditions, you can see that there's essential hypertension and it was observed in 2019, and so forth. You can see which doctor diagnosed it and when the record was imported to MyLinks. Once you have your records, you can easily share with doctors, family, or anyone you need to. MyLinks has a lot of ways for you to share your data, including a 24-hour access link you can generate at any time. No login required for the recipient. I think that's pretty cool and it really an easy, effective way to share. That way, the person you're sharing with doesn't have to store your data either. They can simply view it and do what they need to do. So a big topic that comes up is security. So MyLinks was made by patients for patients. So security is critical. Patients have a right to their privacy, and we take every precaution to protect that privacy. We'll never share your data without your consent, and we do regular testing of our security safeguards and update as needed. So as one of the laws kind of mentioned earlier about following industry best practices for safety and security, privacy. So data encryption is a must. You know, that basically means your data is converted into a string of characters that doesn't make sense. It needs an encryption algorithm to decode it, and storing that encryption key is paramount. So that's kind of a big part of security there. And then OAuth 2.0 is a workflow process that is basically the part in the process where you would authenticate in the patient portal, and that gives you you know, authority to get your own data from that server. And then we do everything in the HIPAA compliant cloud. So all the vendors we work with are security oriented and focused. Just another way to keep the data safe. So we have some new features coming, clinical notes being one of them. Since more and more connections are now providing it, we created a new category to show the clinical notes. And in this category, you can see which notes you have and what doctors they came from. And then you can also view the details. So you can see exactly what the staff wrote about wrote on that note. So we had some questions from previous demos, and I wanted to kind of go over them. So this one, why can't I find my health organization listed in MyLinks? So we're adding new health organizations daily. It may just be a matter of time until we're able to add your specific connection. Some organizations are architecting the way they handle the transmission of digital medical records to prepare for the December 2022 compliance date. There are many reasons why we may not be connected to your provider at this time. We're doing everything we can to get connected, but sometimes there's some things out of our controls. On the Gather page, there's a link for Missing Clinic. If you click that link and submit your missing clinic to us, our support team will add it to the priority list of connections to add to MyLinks. So we'll try to hunt down that connection and add it for you. And then we'll notify you if we do indeed add it. And then we've also noticed some clinics use a name you may or may not be familiar with. Sometimes they list their connection under their parent organization name. So we find it helpful to search by city and state sometimes and see if you can recognize them by another name. Another question that comes up is, how can you combine your records if a doctor doesn't have a patient portal? So this is a great question. So some providers may have a Fire connection available, they just don't have a patient portal solution. So that means the connection could be available to MyLinks, even though your provider doesn't seem to have a portal. If this is the case, you would need to contact your provider's office and ask them how to authenticate to get your medical records via Fire. Providers in this situation may use other means to authenticate patients. A couple examples I've seen would be Google and Microsoft for authentication. This method requires the patient's Google account email address to be on file with the provider. By December 31st, 2022, all clinics using a certified electronic health record provider will have to provide access to patients using a Fire application like MyLinks. With the mandate comes a requirement providing you with a way to authenticate. And if I haven't explained before, Fire stands for Fast Healthcare Interoperability Resource. And it's basically an API language or guidelines for building an API, so that all these organizations can kind of follow the same rules and move data around without major issues. So Fire will be mandated to be available to all providers by December 31st, 2022. So we're really excited about that because that'll really open up more connections to all patients. And then my last question is, does MyLinks have a relationship with all the providers it has connections for? So we're following the government's mandate and trying to provide patients with access to their data, leveraging those mandates. And we do have a relationship with some of the providers, but it's really dependent on how their system is set up and how they are using Fire. Many providers use systems where their connection info is publicly listed. In that scenario, it's easy for us to, see that connection info, plug it into MyLinks, and make that available to patients. So it's really a neat thing. And just a quick anecdote that I thought of. So our CEO Debbie, she was taking care of her parents remotely, and her mother was in the hospital, and she wasn't getting all of the facts on the phone, from people nearby that could answer questions. And so she was using MyLinks and pulling in her mother's data into MyLinks, and she was actually getting more data and she was getting more data through MyLinks than the patient portal. And they were critical details that kind of helped her help her mom in a kind of a bad situation at the hospital. So and I'm just a data nerd, and I think unlocking data and putting the patient in control of their own data kind of helps them control their patient journey. So I'm terribly excited about MyLinks. I use it myself. I think it's a lot of fun to see the records that have been documented on me. And I think putting the patient in the center of their healthcare is going to be just huge for patients. I think it's a huge win. If anybody should be able to get and manage their data, it should be patients. It's their data after all. So with that, I'd like to say thank you to Carla and NeedyMeds for having us. We've always valued our NeedyMeds relationship. We think the drug discount card they offer is a huge help to patients, and just love being able to partner up. So thank you, Carla and NeedyMeds.
Thank you so much, Brian. Yeah, it's a pleasure to partner with MyLinks, and as everybody can now see, our missions clearly align because a big part of the NeedyMeds mission statement is educating and empowering our users. And as Brian said, this is very exciting because if anybody should have immediate, up to date, and accurate access to records, it should be the patient themselves because, as he said, it puts the patient in the driver's seat of their care. And that's something NeedyMeds is very passionate about. Again, empowering people when it comes to navigating their healthcare journey. So thank you so much, Brian. And something that always jumps out at me and why we're so proud of the partnership is MyLinks for me, who now Brian is, as he said, self-proclaimed data nerd, techie person. I am the opposite. So I need something that I can understand and that's easy to access. And the thing that I love about MyLinks is that when you go to their website, download the app, it is really simple to make your way through it. So that's something that is really useful for me. And I'm glad that Brian mentioned that anecdote about Debbie and caring for an elderly loved one that may be at a distance. Actually, before we started the webinar, Brian and I were chatting about that, the challenges of caring for an aging loved one. And that to me is one of the most powerful things about MyLinks, that you can have access to somebody who you are playing the caregiving role for. You can see their records and you can share them. And you also pointed out, Brian, that 24-hour access link. That's something that was really attractive, allowing somebody to just log in, see for themselves what they need, but that link does expire. And those statistics shock me that you said in the beginning of the presentation that up to 70% of patients' records are wrong. potentially resulting in 250,000 deaths each year. I mean, I literally wrote that down as you were talking about that because I couldn't believe it. But anyway, I really appreciate Brian coming on board to give this very straightforward and thorough presentation. We do see some questions coming in, which are great. Right before we get to those, I want to remind everybody that Needy Meds is a source of support for you as well. If you are having trouble affording your healthcare expenses or are looking to save on those healthcare costs, reach out to Needy Meds. Check out that healthcare savings tab. Give one of our expert call center counselors a call or join us for one of our monthly overview webinars, which are usually titled something like Help with Affording Healthcare Costs or Help Affording Healthcare Expenses. And again, you can find those webinars in two places, under that education tab, but also under that calendar of events on the bottom right side of our homepage. So as we reminded you, you can type questions into that questions section of your GoToWebinar control panel. And as we get to those questions coming in, and it looks like they are all for Brian, I don't see any Needy Meds question coming in. I'm going to go ahead and, as promised, leave the contact information up. You can see MyLinks contact information right in the center of your screen. At the bottom of that page, you can see our website, needymeds.org. Our toll-free helpline, which I promised I would put up there, 1-800-503-6897. Don't hesitate to reach out to our expert call center counselors. They're available Monday through Friday, 9 a.m. to 5 p.m. We're in Massachusetts, so that is East Coast time. And we also have Spanish-speaking counselors. If you have any questions about today's webinar, you can reach out to me at my email address. Again, that contact is on the bottom left-hand side of the screen. It's Carla with a C, carla@needymeds.org. So let's go ahead and get to those questions coming in. Here's another one I bet you get a lot, and it was actually a question I had when I was first introduced to MyLinks, which is, what if I don't have a patient portal username and password for one of my providers?
Yeah, good question. So you'd need to reach out to your healthcare provider and ask, how you can set up a patient portal account. Usually you can go to your organization's website and look for information about the patient portal, and usually you'll find instructions for creating that account.
Thank you so much, Brian. And you spent a lot of time, which is important, explaining why MyLinks is such a secure platform and app. Super important. But we have actually more than one of our attendees asking, what does MyLinks do with my data? And I think that's a really important question.
Yeah, so really the only thing we do with your data is store it and hold it for you to use. We don't share your data with anyone without your permission. In the future, there'll be opportunities for you to share your data with researchers and things like that. Again, we would have to get your consent before doing anything like that. So really all we do is encrypt your data and keep it safe in our HIPAA compliant cloud for you to use whenever you're up to it.
Thank you so much, Brian. That's an important question, and I'm guessing one of the questions you probably get pretty regularly.
Yeah, definitely.
So here's another question. How does MyLinks make money then?
Good question. MyLinks doesn't actually make money. It's more of a passion project that started with our owner Debbie. She was looking for a way to help manage her parents' health. They both lived remotely, and she needed to kind of keep track of their medications, their allergies, and so she kind of tasked our team with building a personal health record, somewhere she could manage that data. And at the time, Fire wasn't around, so it'd either be data entry or connecting with certain organizations, but it'd be the connecting with them would take months and months. It'd be a very custom each time, whereas Fire allows for more of a plug and play solution. But anyway, so she started building this personal health record, and then Fire came out, and it looked like a perfect way to get data, especially medical records data. So So we started exploring that, and then basically built MyLinks on top of Fire to allow us to help patients import the records. So um, we actually make record money from our other products, and our other products are all about getting data into the EHRs, or electronic health record providers. So if you've ever digitally checked in for an appointment, we have products like that that help providers save time and care for their patients more.
That's a great answer, and I'm moved by it because it's similar to the history of Needy Meds, which is that our founder, he co-founded with his friend Libby Overly, who was a medical social worker, as I said at the beginning. But Rich Sagal, who's been the president of Needy Meds for more than 2 decades, started Needy Meds not as a way to make money, and he did turn it into a nonprofit organization, but it started because he was attempting to fill a need for patients. When Rich was a practicing family physician in Bangor, Maine, and Philadelphia, Pennsylvania, he was treating patients and regularly noticed that his patients were not getting their medication filled. And when he found out, one of the top reasons was because they couldn't afford them, he started looking around for cost savings options and found something called patient assistance programs. And for those of you that are interested in learning more about those, we do have webinars dedicated specifically to what patient assistance programs are and how to find them on our website. But essentially, needymeds.org started more than 2 decades ago with just a couple of dozen patient assistance programs, not to make any money, simply to connect people to these resources that Rich knew would help them. And more than 2 decades later, now we have a website and a nonprofit that employs more than 30 people, and a site that has between, I would say, more than 30,000 points of cost savings. So I'm very moved by the beginning of MyLinks because I think that's really where innovation and change begins. So thank you so much for sharing that. And those questions, as I said, that we've just covered, I'm sure they're ones that Brian and the MyLinks team get all the time. So as I said in the beginning, we do try and keep the question segment brief. Don't hesitate to reach out to us at the contact information on your screen. I hope you go ahead and check out MyLinks website. Shoot them an
Carla,
email if you have. Yes,
and
yes,
if we have just an extra moment, I'd be happy to kind
yeah.
of do a walkthrough.
Why don't we go ahead and do that? Sure. Do you have the your website open?
Yeah, let's see. Yep.
Great. So I'm going to go ahead, everybody, and take Brian up on his offer. So I'm going to pass my screen back to him, and he's going to go ahead and very generously just spend a little bit of time doing a walkthrough to show everybody how MyLinks works in real time. Please go ahead and hang around just for a little bit so you can check that out. I think it's a great opportunity to see how it works in real time. And don't worry, I will go ahead and put on the screen before we wrap up that contact information again. So don't worry about that. One of the things Brian and I were talking about before we dove into the webinar is that there is a little bit of delay when I change my screen or he does. So bear with us while we go ahead and get that MyLinks website open.
Yep.
And while we get to those, I do see a question coming in for Needy Meds, which is how does Needy Meds support itself? Great question, and another one we get all the time. And actually, you can find the answer to this on the top right of our homepage under the About Us tab. You'll see a link to the Needy Meds mission statement. And on there, you will find about 6 sources of revenue that we do rely on. But because I want to pass the mic to Brian, suffice it to say that we are a traditional nonprofit. So we do, of course, rely on grants, donations, and sponsorships. So, Brian, why don't you go ahead and walk us through since we can now see your screen?
Perfect. Yeah. So first you could go to mylinks.com to get started, or search us on Google, and then you would hit the sign up button I already have an account, so I'm going to go ahead and just log in. So this is kind of your dashboard. Basically, it just shows you all the tools you have access to. For today's purposes, we're mostly focused on gathering your records and viewing them. So I can go to Health Record and gather, and then I can search for my provider. And in this example, I'm using Montrose Memorial Hospital. So I found their listing. It looks like the right address. So I'm going to go ahead and get Health Record. And now I'm presented with this. This is their patient portal. So, whatever your provider patient portal is, that'll pop up. So if it's Follow My Health or Epic or another, you'll see that your provider's patient portal here. So I'm going to go ahead and log in with our test patient account here. And a lot of times these patient portals, they're going to tell you, what's happening. And basically they're saying, hey, we're connecting. MyLinks is connecting to our Fire server on the patient's behalf. Is this okay with you, the patient? And so I'm going to say yes. Let's go ahead and initiate health sharing. And then you have to confirm that you want to share this identifiable information. And you're basically just agreeing that this is okay to transmit records. And then it's just going over it all one more time. And each patient portal is different. So now MyLinks is saying, hey, the name of the patient is different than the name of your MyLinks account. Are you sure importing this data is what you want to do? We mostly have this warning for people that manage multiple accounts. So that way you don't accidentally, import your mom's records into your own account or something like that. So I'm going to go ahead and import. And right now we're making about 15 different Fire calls. We're making one call for allergies, another for labs, another for documents. And then we aggregate all that data and pull it into the dashboard here. So that was like a real data import, just like a normal patient would do from Montrose. So I can go explore my medications that they've got. I can see when the doctor prescribed it. Different providers have different levels of data. So this endpoint was on a slightly older version of Fire, so we're not getting the provider name. But when they update, we should start getting the provider name, for instance. But we display as much as we can. So whatever we get from them, we try to display to the patient, just so you can see what's going on.
That is so helpful, Brian. And I like that we're able to share with our attendees what MyLinks looks like in real time, what the platform looks like. And I really like on the left-hand side, you can see where your mouse is now. You can see all the entry points, all the data points that's being collected, so that you know that this is very thorough. You're not going to be able to get a more accurate picture of your health records than MyLinks. So this is super helpful. Before I do go ahead and grab the screen back, Brian, is there anything else you'd like to share with users?
Yeah, just real quick. So you can view your records, you can gather your records, and you can share your records. So there's a few ways to share it, and you can export your health record to a PDF. Send via email or however FTP, whatever you want to do. 24-hour view only. It's super easy. You just create the share link and then provide the person the PIN number over the phone. And then you can share access to your account. So if you have a loved one that you want to share your account with, you can. But yeah, I think that covers the major stuff, Carla.
That's wonderful, Brian. I'm really glad you were inspired to just jump on the live website because, like I said, just looking at it in real time is pretty invaluable. And I think it shows everybody how easy it is to navigate. So, with that, I do want to thank Brian for taking time out of his busy schedule to share his expertise about MyLinks with NeedyMed's users. We certainly consider it an invaluable resource for users. And a thank you to our attendees that took time out of their day to join us for another NeedyMed special topic webinar and learn about our partner, MyLinks. We do hope to see your names pop up in future webinars For now, thanks so much for your time, everyone. Have a happy and healthy rest of the day. Thank you, Brian. Take care.
Thanks, everyone.